remember that patient came back and she's like, yeah, if I would have seen your social media prior to me coming in, I probably wouldn't have come in.
Hey everybody, welcome back to another episode of the Difference Makers podcast. I'm your host, Dr. Jim Hovind, and I get a chance to meet cool people every single week doing cool things, making a difference in the community, not only where they live, but outside the community. And today is no different. Today, my guest, I have a couple of really, really close connections with this gentleman. His name is Dr. Dorsa, and we have become friends through the craziest of ways first. And it's crazy because we both got connected by golf, and neither one of us are golfers. So that was kind of a funny story as we got through it. But now we're connected in deeper ways too, because we're both doctors of chiropractic. And I wanted to share or have Dr. Chris share his story because it's amazing. Some of the things he does, the way that he goes about taking care of patients and specific type patients. You're going to want to hold on for this and listen to this. And also some of the unique things. This is a unique individual and a unique doctor of chiropractic. So without taking any more of Dr. Chris's time, Dr. Chris Dorsa, welcome to the show.
Thank you. That's such a good introduction.
Hey man, it's all true. It's all true. Remember that first day we met, you and I were in a golf cart, like, what the heck are we doing here? Because we didn't golf and we were with two good golfers. Mm-hmm. And so it was, thank goodness, one of those scramble tournaments where all we had to do was, we would hit the ball that we didn't use and then we'd just jump in the cart and talk and hang out. And
yeah, they definitely put the team on their back.
They put the team on their back. And
we had maybe a few shots.
Yeah, and you and I had a good time. Yeah, we had a few shots that worked, and then we had a good time, got to meet each other. Yeah. And the one thing I remember from that very first meeting with you, which has been, 4 or 5 years ago now, was that you had this commitment and this connection to doing things a little bit different, and that you're very soft-spoken, mild-mannered cat by nature, but that you have this burning internal desire to be great. And so would you just share with our audience as we start what you do as a chiropractor, what your chiropractic mission and vision was, and how you got to the point of saying, man, this is my life's work?
Yeah, I guess it didn't start that way. I always had a vision in chiropractic school to, have a practice, thriving practice, and kind of just sports was what I was interested in.
What sports?
So I grew up boxing, wrestling, jiu-jitsu. That's kind of how I got into the profession.
Combat sports.
Yeah.
Yep.
So I've had 2 hip surgeries, hand surgeries, and I wanted to be an orthopedic surgeon. So I did a lot of shadowing with that, and I discovered chiropractic in my pre-med at University of Miami, and there was a doctor of chiropractic that came and spoke it was an alternative medicine class, so they would have a different speaker come in, and at that point, I always thought chiropractic was kind of a woo-woo, wasn't familiar with it, and he ended up being the chiro for the Miami Dolphins. And so that kind of opened up my mind to the profession. If, these pro athletes are getting it, then there's probably something more that I don't know. And, doing the shadowing and watching these patients come in hurt and walking out with a smile, however long that appointment time was a lot faster than watching, a surgery patient. You don't really get that immediate satisfaction. So that's what kind of drew me to the profession. And, I've been fortunate with how things came up. I started my practice a month before COVID happened. I know we were just talking about that with you guys moving into this building, but, most people would look at that as a negative. I did have to shut my practice down, I think, for about 2 months. But during that 2 months, I still showed up at my office to, build out the website. I was just a solo practitioner. I was working out of a CrossFit gym, and that kind of gave me time to learn how to shoot videos and edit videos and figure out social media. It was never my intention to blow up on social media. It was originally just designed to create a rehab library so that when my patients came back on board, I had a resource I could send them to for commonly prescribed exercises. And I had posted a video of, I'm kind of going off script here.
No, there is no script, man. This is great. This is great.
I was like, the original question was not all of this, but I had posted a video of me adjusting one of my friends. I had put like a microphone on it and was just kind of playing around with the audio. I was playing with different microphones, and I decided to post the video, and the video got, 50 views. So not a lot, but like more views than 1 or 2, which is what, it was just for myself. So I was like, okay, other people are seeing this. This must be the thing on the internet. And so I kind of listened to the comments. They were like, hey, post the whole video. We want to see the whole thing. And I started looking around, and I realized that there's these massive chiropractic channels that have like 2 million plus followers, and, people just watch their treatments and their protocols and what they, kind of do. And so I started leaning into that more, posting more treatment videos, fuller videos, listening to the comments and what they wanted to see. And ultimately I was like, I think I have like something different than what's already on the internet. There's so many different styles of chiropractic. And so I decided to kind of push into that pretty hard. And ultimately this is 6 years later from the start of my practice. Very happy with, where things went. I'd say like 95% of our patient base comes from TikTok, YouTube, Instagram. And I think social media has done an amazing thing for the profession, because I think before it was kind of this like unknown, like how I saw it when I first started. I didn't really understand it or see it or know what you were getting into. And now you can, full scope, you have a viewpoint into somebody's office and how they look at things and look at the body. And, I think ultimately, it's a big push right now, even in medicine, to get away from the opiates and have an alternative form for pain. And so that's kind of, my mission. What I'm trying to show to the world is, that there are other ways to, deal with things.
So what do you think about this, Chris? Because I graduated from chiropractic school in 1991, no internet, no social media, no nothing. And I remember there was a time where our teachers taught us, they were like, look, you don't adjust people in public. Yeah. They come to your office because we're real doctors, and we got to make sure that we set the tone, that there's an examination, a consultation. We've got to create the validity of saying this isn't a sideshow trick of some sort. And so that was the culture of the chiropractic culture, not out in the world, but within chiropractic to legitimize what we were doing. Right. And what I just heard you say is the public wants something different. Because when I've heard of, and I'm not deep on social media, but I've heard that some people just like to listen to what you and I will call cavitation or audible. Right. The universe outside of us calls it cracking. Yeah. They just want to hear that noise. So they'll turn to, and they're like, oh my God, look at that. How did you not break their neck and all that stuff? Yeah. Did you find any resistance to that, or was there something, or just the generation that you're in, like, no, it just totally makes sense that people want to see that, and I'll film it and all that stuff.
Yeah. So, ASMR, I didn't know about that.
Let's talk about that. What is ASMR and how does it work?
I actually don't know the acronyms. Okay. From my understanding, it's an audible sound. So like people will listen to it to kind of relax. So there's something that clicks in the brain that helps people like fall asleep.
I've heard of that. So it could be anything.
Somebody eating.
I've heard of that. Okay, that's what we're talking about. All right, I have heard of that.
They'll have like stories where they like tap on the mic and whisper in your ear, and it kind of gives you that like tingly sensation. And so that's actually an aspect of, the video content. So like you said earlier, it was, the circus act, right? Like we don't want to turn our profession into this thing. And in school, we also were taught the same thing. So it was a very, absolutely don't post your adjustments. Don't, share. Like you could share education stuff, but definitely don't show adjustments. And it's interesting. So now I'm kind of dealing with it. When I first started, there weren't that many chiropractic videos. I think I was 2 years behind the trend. But you could just post somebody getting cracked and the videos would blow up. Now every chiropractor is doing that. So there's like an influx of those videos. I think people are kind of tired of them. And so I look at that as like, yes, you have to draw an audience in some way. I call it like hype chiropractic. It's tough sometimes because when you're at an event or, I do a lot of artists backstage, it's hard to kind of go into like a full assessment when people are, have their friends there laughing and, creating this thing. You have to, you are kind of orchestrating this act to draw the audience in, to get views. And so I see that as like maybe if social media is a TV channel, right? So like my social media, the videos that I post, like that's what people are wanting to see. But now I'm like, okay, now that I have an audience, watching me, now I can kind of throw little things at them like education. So I'll go in and, talk about what I'm doing. So I just learned nasal release techniques. So that's interesting to me. So now I can kind of educate that to the masses rather than just keeping it into like a seminar or one-on-one patients. Now I can kind of, talk about that and show that to the world as maybe another option for pain. They don't get as many views, but it's still, I guess, going back to the original question, my ultimate vision is to, create social media, change the industry, and change people's mindsets around the profession. I think, chiropractic is kind of set in this old school manner. I think a lot of the schools still kind of stay in that philosophy mindset versus looking at literature. I think that's where like PT does a really good job of is, I think, or actually you're a big literature guy. So maybe you can weigh in on this, but from what I see in my understanding, I feel like PTs are putting out a lot more literature than chiropractors as a profession, and chiropractors are actually using physical therapy literature. Anyways, I'm not sure where I'm going.
No, that makes sense. And it leads me into something when you mentioned old school, Dr. Chris, is for those of you that are not watching us. So if you're seeing me look at you right now, you're watching us, but a lot of people are listening to us and hearing your information. If you're listening, you're going to want to go check this out on YouTube after this next statement. You don't look like your traditional doctor. And what I mean by that is obviously you shared that you were in combat sports, and in combat sports, a big part of that whole culture is tattoos, right? It's a big thing. And I don't know when you started getting tattoos, but you have a considerable amount of ink on your body, all the way up onto your neck and even kind of by your ear. What has that done? And on your forehead. What is it? What has that done for you? I imagine internet-wise, it could really help the sensation of who is this cat? Like,
totally.
He's not your typical doctor, but has there been a negative to it in some way too?
Yeah, I really haven't seen too much negative, but it's definitely opened a lot more doors and allowed me into different demographics that don't typically see chiropractors. My best friend he started off as a patient, and he is in the Mexican culture community. And, he's like, my people don't really see that or, go into that type of care. I was really nervous to see a chiropractor, but I've always had this pain. He's like, when I saw your videos and what you look like and how you talk, you look like me. And that made me feel comfortable going in and seeing you. And so I find that a lot. We definitely have a culture to our practice. It's not traditional. It almost, when you walk in, you don't feel like you're at a doctor's office at all. There's spray painted walls all the way up to the ceiling, and we all wear kind of t-shirts and scrub bottoms, very kind of casual. And I think that's important because, like my friend had said, he was afraid to go into the chiropractic office because of that kind of white coat syndrome. And I've taken that to a degree from this dentist that I follow online. He's a pediatric dentist, and I think, a lot of people can, feel the same way, being afraid of the dentist or being afraid of a doctor. And he, purposely just wears normal casual clothes so that when those kids see him, they don't get that like, oh no, this is some official guy, and they don't tense up and they can talk to him like a person. He has a basketball court in there, and
nice.
He has his shoe wall with all the dunks and stuff. And it is fun. I feel like I can, connect a little bit. I am a kid myself, but I feel like I can connect with, kids and, not create that scary experience for something that, usually is scary for a lot of people.
Do you have much interaction with other providers, whether it's medical providers, other chiropractors, and how they feel about the whole internet thing and the tattoo thing? Yeah. Do you get feedback, or is everyone just like, yeah, man, be you? I think it's really cool and unique, and so I just kind of wonder what feedback that you get living that world.
Yeah, I was really nervous, especially, so when I started chiropractic, I actually had 0 tattoos. My whole focus financially was to, pay for school and pay for the buildings and the practice. So everything kind of went back there. It wasn't until I tattooed, I think tattoos are very common now.
Yes.
I think, most people that I work with have a tattoo at least, or, something. It's not seen as necessarily a counterculture thing. Mm-hmm. Doing my neck and my head and my hands was kind of scary for me, being in the PI world where we work with attorneys and medical doctors, and we're collaborating in that space for the patient care. So yeah, I remember I had, after I'd done my neck, I had a meeting with some attorneys, and I was like, maybe they're not going to like me, or maybe they're not going to want to send to me. But I think ultimately at the end of the day, if you can, speak your truth and you're good at what you do, people don't really care.
Yeah. Did you find that there was a barrier to overcome to get them to trust you if they didn't know you prior to the tattoos, or not a big deal?
I don't think so. I have not experienced that. I'm sure it could be a thing, and I'm sure that, it does sway people away from me to a degree, and that's okay. Not everybody is for everybody.
Yeah.
Patient-wise, it is interesting. I am conscious of it, so we can see when a patient comes in where they're coming from. So if it's TikTok, YouTube, or Instagram, I already know that they know what I'm doing. And it's kind of fun because they kind of already know what they want, and they're kind of invested into the brand. But that 5%, that might be coming from like a car accident case or from Google, they probably don't know what I look like. And so I do overcompensate to a degree using, heavier words, like bigger words, until I kind of gain that trust.
Brilliant.
But I think at the end of the day, like people, it's subjective. Like you came in not feeling good. If you walk out feeling better, feeling like you have a plan set in your head, I don't think that they really are looking at that. I've had some patient experiences like that where somebody comes in from Google and they didn't necessarily know who our office was, and then they go into their work and they're like, man, I just came from this chiropractic office and it was like the craziest experience. The guy's all tatted, and the coworkers are like, oh, is it this guy? Because in Denver, it is funny. There is like a very local base. And I remember that patient came back and she's like, yeah, if I would have seen your social media prior to me coming in, I probably wouldn't have come in because it was intimidating to me because all of your patients are, famous rappers or, really tattooed people. And I don't feel like I fit what your patient demographic was. And so that kind of opened my eye to a degree. And I was like, okay, well, maybe I'll start finding our patients who aren't tatted to, put on to show that we actually work with everybody. And I think you attract what, you put out into the world. And our patient demographic is very heavily tattooed. And it's just a different office, but I don't overall think that the tattoos have held me back in any way.
I love it. And I would agree with you because there's only so many hours in the day, right? And so you can find capacity in any market, in any niche, and in whatever. I'm interested in at the moment. So I want to take this now kind of into the clinical phase of things. But before we get too deep into that, because you are an expert in something that I find so interesting and so bananas compared to what most chiropractors do, which is dealing with people with spinal cord injuries. Yes. I want to get to that in a minute. But before we do, as we transition to that, I want to talk about what it's like in dealing with the famous folks. So I'll give you a quick story. So I have a diplomate in sports injuries. Okay. And there was a time where my life was I wanted to teach people stuff, do lectures all over the place, top for rock tape all over the country, and treat pro athletes, right? Like that's what I wanted to do.
We're the same.
And so, I had a chance to work with the Pro Beach Volleyball Tour, and then I had a chance to work with the Pro Mogul Tour as they came to Colorado many years ago. And it was so interesting because the different athletes were completely different. Pro Beach Volleyball Tour, they saw a guy named Tim Brown who brought kinesiotaping to the United States from Kenzo Case. Like he's the founder of kinesiotaping here in the U.S. Right. He's become a great friend. He's an amazing guy, right? Okay. None of those athletes wanted me to adjust them because they all went to Tim.
Right.
So when they were here, he's in California where they're all at. So they would have me do muscle work and stretching and all of my little special techniques, but don't manipulate me, right? Then we go up to, we're in Aspen and, in Vail, and it's the Pro Mogul folks coming in. These guys never heard of any kind of PNF stretching. They didn't know anything about anything because they were the fringe pro athletes. Okay. Now at the Pro Beach Volleyball Tour, they had power bars, they had Gatorade, water in the tent. Okay. In Vail, for these guys, they had bread bowls full of stew.
Oh my gosh.
And Patron tequila.
Okay.
What could possibly go wrong?
Yeah.
Let me tell you.
That's okay.
So I'm working on all these athletes, and all of a sudden we go out into the snow and we're watching. And normally they pair up in the bumps, right, for the freestyle. They bump up, two jumps. It's style, it's speed. They give a combined score, and then it's an elimination on who goes next. Okay. So as I'm watching up at the place, or two of us working the event, as I'm watching, there's only one dude at the starting line. And I'm watching down, like something's off. Like not only is there just one dude, but something is off. The guy takes his first several runs, he takes his first line, and as he hits that first jump, I realize, fool is naked. Straight up, zero clothes on.
This is an official event?
This is an official event, pro event.
Wow.
He hits the ground, lands it. He comes up to the next deal. He hits it. He pulls out this beautiful jump, and then he wipes out. He is done. I mean, his skis come off. He's messed up.
That sounds terrifying.
The crowd is going haywire, right? And all of a sudden, as he's putting on his gear, a dude skis out with a single bib for him to put on. Turns out he got liquored up on the Patron in the tent, and he was already eliminated, so he just jumped on course. Pro athlete, right? So very different on how these guys respond. So with that story kind of being the foundation, what's it like when you're treating famous rappers and famous combat sports artists? And are they just like me and you, or do they come with their own set of special stuff you got to deal with?
Yeah, it's funny. I mean, it's such a broad category, and I don't necessarily want to get into names and things like that. At all. But yeah, I'd say like the athletes love it, right? They've already, they have 10 different chiropractors and PTs that they've seen. I guess the most recent was Nigel Houston. He was coming off the Olympics. We had worked with him, and it's fun, working with those athletes because they already know what they want. And so you can just kind of listen to them and, see if you can maybe give them something different that could help, a chronic issue, coming from a new lens. The music world is very different. I'd say specifically I'm more into hip hop rap culture for, the demographic that we see. It's perfect because, when they come to Denver, our place kind of hosts them. We have barbers in the office, so they'll get their haircut.
So
they're
cool.
on the road. Yeah. So we've tried to create like a one-stop shop so that they can kind of get some relief before their shows. But a lot of times it's their first time ever getting adjusted. So it's a very, funny thing for them.
And is it from their people that they hear about you, or is that an online thing? Like, how do they connect you for their first time?
Either their management will reach out to our office, or I'm just so connected within the Denver community with, our CBD brand is heavy with the marijuana culture, so we have a lot of patients in that demographic, and that demographic tends to lean into the rap culture, and so a lot of those clients will connect us. So there's a lot of different routes of how they discover us, but yeah, those patients are it's funny because they're so good at articulating what they're experiencing because they're lyricists and they are very good with their words, and so I love doing those videos because it's typically their first time getting adjusted. And listening to their reaction, and they're good with the camera too, you can really feel and experience what that person experienced because of how intelligent they are with their brain and their words. So I always really enjoy whatever they come up with, or how do they describe what's happening to them. And that's like a piece of what I'm trying to show is, I shoot content. I like having the storyline, even if it's a short video of somebody coming in, maybe being nervous or scared, or unsure of like what they're going to get into, but they have an injury, and then we get to show that before and after, with them laughing and excited about like, oh my gosh, I can turn my head over here. And so you can create this like really short, fun, experience in like a 30-second video that I think ultimately adds positivity to the industry, and gets other people thinking like, oh, okay, this could be an option for me. I couldn't turn my head to the right. Let's try this out. And whoever, their demographic might be, can kind of push into, our industry to a degree.
I love that.
So it's been fun.
It's so incredible, man. It's so cool. And I respect like that cool factor is amazing. And on the other side of the cool factor is your commitment to these people that have literally life-altering, permanent injuries from a spinal cord damage that occurred from some traumatic event.
Totally.
How did you get into that? Like that was something that, again, at school they say, no, don't mess with it because there's so much that you could do, not only to the potentially the patient, but to your career if you get blamed for something and all these other things. You went through with fearlessness to help these people. I want that story. And then what do you do on these folks?
Yeah, it was not necessarily my intention. I didn't come out of school being like, I want to work with spinal cord injuries, but that is heavily what we do learn in school is the red flags. I think that's what the education system is really good at, but I think for most people, they'll never actually see that in their careers. It kind of happened to me, I guess, and I ran with it. When I opened my office, it was in a CrossFit gym, and neighboring us is an adaptive rehab center, and I didn't know that when I first moved there. I was typing in chiropractors near me and they popped up and I was like, shoot, did I just open up next to a chiropractic office? So I walked over there and I was like, hey, I'm a chiropractor. I just moved next door. And they're like, oh, great. They're like, everybody hates our chiropractor here. Let's work together. And I found out that, through the treatment, it was just somebody who was, kind of looking for a paycheck, was just kind of clicking them with an activator, doing like a vibration gun. So it wasn't really bringing chiropractic to these patients. I think, a big part of it is taking them from their chair and putting them flat onto a table. I think just doing that shows that you care. And even just, getting somebody who's sitting all day into this flexion position flat is going to be positive for them. It's called New Ability. They do adaptive rehab, and then the spinal cord injury waiver covers their chiropractic, their acupuncture, and massage once a week. So it's great because they're not having to pay for the care. It goes through Medicaid, which I think is the only time where Medicaid will cover chiropractic
1,000%.
is through this.
Yep.
So typically the patients, they're 3 months post Craig Hospital. So a lot of people get flown in. Craig Hospital is known for spinal cord injuries. Yeah. So people will, fly in from other states and do kind of their, getting back into their new bodies and learning how to operate. Typically after that first 3 months, they'll kind of get shot off and, have to figure it out. So there's a few different centers. New Ability is one of them that will... it kind of creates this culture for them. It's really cool having, a lot of these patients I've seen my whole career, once a week. So it is family. We'll hang out with them. We'll go play wheelchair rugby with them. It's not, I'm friends with them. They come to my birthday. We have bachelor parties, and it's, a very inclusive environment. And yes, I do their chiropractic. But I think it's important to get, the full scope of, I actually care for you in real life too.
Yeah. And are you working strictly above the lesion, or do you, in other words, are the spinal cord damages, or do you go below where they can't necessarily, they're not getting motor control, they can't feel things necessarily? Are you working above and below? How does the process work?
Yeah, so we take a pretty big, intake, right, with what hardware they have, what levels they're at. Obviously we're not adjusting where hardware is, but I think it is very important to adjust the segments above and below that, now that we have a few the segments above and below are working extra hard because they don't have that range that used to be there. It's definitely, what we would consider like a contraindication to just like avoid that altogether. I'm obviously very careful with kind of, how we go into it. We're going to slowly, dive into it, see how they respond. But for the most part, I think the low back is like one of the most important things for them is, they're sitting in a chair all day. And if they're quadriplegic, they typically aren't going to have good core stability or control. And, just getting those segments to move into extension and showing it the opposing direction, getting something squared away. They always notice, even if they can't feel their lower extremities or abdomen, they notice that they sit a little bit straighter in their chair. And so I think that's, it's a really cool case where they're able to get weekly chiropractic care. And, obviously I'm not making people walk again. That's going to be more like the PT route. We do have quadriplegics over there that can walk, which is so incredible to work with.
Amazing.
It's, a lot of the injuries out here are, ski accidents, snowboard accidents, motocross. We've had plane crashes, train crashes.
Probably mountain bike.
We've had Columbine patients. We have, the movie theater shooting patients. So it's such a broad category, but a lot of these people are super active in, extreme sports. And so to take that completely away from them and, now you have this, I think that environment and PT, a lot of them are very motivated to okay, what can I gain from this? What, other things there are. And I've spoken to a lot of them that I think there's a handful that are looking at Paralympics for wheelchair rugby. And they say, they have such a positive outlook from what you and I would see. Obviously you're going to have that initial hit, but a lot of them, talk about how fortunate it is that they wouldn't be working with like the Paralympics or doing the things that they have or meeting the people that they've met. So
I bet that's had a big impact on you emotionally.
Yeah. Totally. It's, putting yourself, I've played wheelchair rugby a handful of times, and they have wheelchair basketball, and putting yourself in that chair, and seeing what limitations you actually have is a very interesting experience. If the ball goes high, like I've caught myself using my legs just to catch that extra distance. I'm like, oh, I shouldn't be able to do that. I had tattooed my hand about a month ago, and it was completely wrapped up, and just me not being able to use my hand, it really, I guess I'm more conscious of those things, more conscious of, I hear stories all the time of my patients not being able to get somewhere because somebody parked too far into the sidewalk and they have to wait for that person to come out, or, it snowed and they took their car out and there's no handicap spot. Somebody parked next to them and now they have to wait an hour in the cold. And so you really gain, a perspective of, how fortunate we are to have fully, movable bodies. And, but that there's so many, like I think the United States is number one for accessibility. So then you think about other countries that have injuries like this that don't have access to, palliative care, or, sidewalks or handicap spots. I think Japan is number 2 for accessibility, and they've modeled their stuff off of the United States. So I think a lot of people, when they go vacation, if they are a spinal cord injury, Japan's a very good option. There's definitely, it is very rewarding to be a part of somebody's, life and healing journey.
Yeah, that's incredible.
That's why we got into this profession.
Absolutely. Mm-hmm. And I know just from us even talking prior to us beginning to shoot, is that impact has not been lost in translation from, okay, provide care, it's affected me internally, so I'm a better person, and hopefully I'm more thoughtful, and I give better care, and I do my thing. You actually have taken, at least I'm connecting the dots here, that with that, you've also taken that to say, how can I give back? So we were just talking that you love paintball, it's a big passion and hobby of yours, and that you actually were helping charity organization by donating care, that all of the money you received from the care was going to that group. To me, those dots have to connect somehow on what you see with what these people experience and your willingness to give that away and give of yourself and who you are. And I just think that's really cool. You want to share something about your philanthropic efforts?
Yeah, I think having good care accessible to everyone is very important. We've really tried to not increase our pricing due to social media. So you'll see a lot of the chiropractors that, have hundreds of thousands of followings. If you want to go see those guys, people are flying out and paying, $500 just to get like a cervical adjustment from this person, and that's it. And these chiropractors, typically, if they're doing well on social media, they're probably like a good chiropractor. It didn't just like randomly happen. And so that's one of the things I've kind of focused on, is still making good chiropractic accessible. I think it's tough with, insurance, if we want to get into that. I've tried a handful of times to get into like, people being able to use their insurance to cover it. They just don't pay us enough to be able to like operate a system in the way that I want to operate it. So I like spending time with patients and actually getting to know what's going on. So you're not going to come in and get like the cookie cutter flying sevens is what we call it in chiropractic. Some people don't even get adjusted. We have so many different options with like dry needling, soft tissue, lasers, and insurance just unfortunately doesn't cover those things in the time that you're spending with those patients. And so it's a hard balance of, how do you spend time with a patient and care for that patient, but still make enough money to cover overhead.
Right. And then give some away. Because again, you literally donated the money to the charity. Like, that's a tough line to walk, man.
Yeah. And I guess I don't necessarily have a good answer for that. I haven't thought about it. But I do like, giving back. And I think that's what life's all about is, it's not about making money. It's about making, positive impact on the people around you. And, if you can show somebody love or care, then that's going to hopefully amplify into somebody else in their life. If you're able to make somebody function or take away a pain signal so they can think clearly and, give back in that way, I think, that's where social media comes into play. Is I think about it a lot with when I'm at the office seeing patients. So yesterday is my patient care day. So I saw about 35 patients, and it's tough because like in that time period, I could make 10 videos that can reach millions of people, right? Depending on how viral it goes. And so it's a hard balance. I'm kind of going back and forth right now is, I think by the end of this year, I might start to phase out of care and go full time with social media.
And then just replace yourself with a doctor in the office to provide the hands-on stuff.
Mm-hmm. And we have another chiropractor there. I think we just need one more. So that's kind of what we're shifting towards. But, ultimately, I think if we can get these profession at its source, so the school system, into a better spot, then that's going to magnify from where we're all coming from. So that's kind of another mission that I have. So we have a product line called Dorsa tools, which I'm basically taking products that already exist. I have an engineer that works with me, and we make it better and we have a logistics person as well that makes it so we can source materials for cheaper and get that tool to somebody. So for example, like a scraping instrument. Yeah,
I noticed that. Yep. So like a Graston tool is what it was called back in the day, an IASTM, whatever.
Yeah, and so like thinking back to the school system, when I was a student, to get a tool like that, it's $250.
Yeah.
And that's really expensive just for one tool. I think the sets can go for like $2,000.
Yeah. Yep.
And you're taking from a student who's already, in debt, a lot of debt, and you're pulling more money from them. You're also kind of gatekeeping that tool in itself to the point where only a professional would use that. So we've been able to get it down to like a $30 tool. So now I can teach my patient, it's not that complicated of a, theory or process. Like you can show somebody a video or show somebody how to do that. And now they don't have to pay me to get that treatment done. They can do it for themselves if that's something
like foam rolling or whatever, similar stuff.
And so that's like a piece of the mission. I think, getting like better quality tools. Like I think we have some of these stem units for dry needles that they look like they're from the 90s. And there are so many things in there. Like I have one of mine shut closed, one of the buttons so that I don't have to use all my hands with like a hair tie. And so there's so many things that's just the only company that exists. And so that's the only option we still have is this thing from like the 90s. And so ultimately we're trying to create a product line of about, 20 different products. We're starting with those first two just to, see how that goes. We're doing our hard drop in about 4 weeks on social media.
Nice.
So we've been able to use a lot of really cool tools with AI and, automated services that makes it so we can do stuff a lot faster. When I was shooting videos, it's really tough. I'd work until 6 or 7, come home, eat, and then edit videos until I go to bed. Now we have robots that I can shoot the video and they edit all the content and they actually look at what people are watching in that piece of the video and they can categorize it and create content. It was kind of wild, maybe going off topic, but my business partner, who's very attuned to that, he had taken a picture of me from our website and then put in a few videos of me talking, and then he put that into it, and then he showed me this video of me speaking, and it looked exactly like me, but I'd never said those words before, so he just typed in like write a 60-second script, and it was literally me talking and with my voice.
That's wild.
And he's like, I don't even need you to shoot these videos anymore. It's kind of cool, and I'm excited to see where it goes. I've kind of dropped off of social media for the last year just to solidify our practice here so that I have more time to do that, because it really is like a full-time job if you want to push in that direction. So kind of going back to, the original thing is, I think, my mission is to just drive the overall profession in a better direction and, kind of educate both like chiropractors and patients on the cares that they can get. So,
man, you've done a great job educating me and us today. I appreciate your time so much, man. As we wind it up, I had to ask you, is there any piece of advice that you've either been given along your life path so far or that you've learned that has been fundamental in you creating the life that you've created and that you see as like, man, this is just bedrock of who I am that you would like to share with me and with our audience?
Yeah, I'm not a great words of wisdom guy, but I'd say, the theme of today is maybe just be yourself. I think when I got out of school, I would emulate a lot of people that weren't me. And even being on social media, I would follow these channels and I would try to, be excited and use these crazy inflections and words. And it didn't feel like me, so it didn't feel comfortable speaking in that way. I'm kind of calm and chill and quiet. And I think over time, I got to just be comfortable with the fact that people are drawn to who you are. They don't want to see you emulate somebody else who's famous. So yeah, I guess just be yourself.
I love that. That is so good. And speaking of being yourself, how do people follow you, reach you, connect with you if they want to learn more about your story and watch all the cool content that you're putting out?
Yeah, so pretty much any channel, if you just Google Dr. Christopher Dorsa or Dorsa, that should pop in. It's Dorsa. And follow along for the journey. It's going to be fun.
I love it. This has been really fun. And I know that we appreciate the work that you do on our clients. We send you a good amount of business that are people that we know need great care, and they go to you. And I know that you've entrusted us the same with, trying to help some of your people that might need representation. So it's been a great relationship, man. I look forward to us deepening our relationship and your continued success. So thank you so much for the time, man. Continued success and blessings to you. And for those of you out there watching, I hope that this made a difference in your life. And if it did, please do all the things that he knows how to do better than I. Hit the notification button and likes and hearts comment. And mind blown comments, do all that stuff and share the episode. Give it to someone who might be like, why am I a little bit different than everybody else? Is that okay? Like, clearly we've shown that be you. I love his advice. Be you, but be you to the wall. Right? Make it happen, be you, and keep making a difference. And next time, we'll talk about something cool. And if you have something that you want us to talk about, or you want someone you want me to get their story, just let me know. You can reach me, Jim@ramoslaw.com. So till next time, take care of yourself. And again, keep making a difference.